Hello, this is Sai Manasa, second year medical student in Perpetual University. Today I am going to discuss about how to take blood pressure. What is blood pressure? Blood pressure is the pressure exerted by the circulating blood on the walls of the arteries. It is one of the most important physiological parameters of the body. Factors that influence blood pressure are myocardial contractility, heart rate, vascular tone, blood volume and blood viscosity. As a consequence of the cardiac cycle, myocardic contraction is also called the systolic, and the high point of blood pressure during contraction is called the systolic blood pressure, and the relaxation of the heart is called the diastolic blood pressure. Now let's take the blood pressure of a patient. Good morning, how are you?
I'm fine.
I am Dr. Sai Manasa and you are?
I'm Sai Pujita.
Okay, do you like to coordinate with me to take your blood pressure today?
Yeah.
Before taking your blood pressure, I would like to confirm your details first. You are Sai Pujita and you are 17 years. Okay, so how can I help you today?
I'm having cough.
Cough, okay. Do you have any other symptoms along with cough?
Sore throat, difficulty in breathing.
Okay, do you have any past cases of hypertension?
No.
Okay. Are you under any medications?
No.
Have you consumed any beverages like alcohol and caffeine?
No.
Okay. Now can you please rest for 15 minutes before I take your blood pressure?
Yeah, sure.
Okay, thank you. Examine the arm so that there are no arteriovenous fistulas or dialysis occurring due to the brachial artery cut downs or due to lymphedema. Now let's palpate the brachial artery for a viable pulse. Position the arm of the brachial artery and the antecubital fossa at the heart level. Now let's take the blood pressure. Make sure the cuff of the sphygmomanometer is appropriate with the size of the hand. Make sure there's 2-finger gap between the cuff and the hand. Now let's take the systolic blood pressure. For taking the systolic blood pressure, palpate the radial artery with both the fingers and inflate the air inside the cuff, and at a point of time you won't feel any more palpitations at the radial artery. At that point it is called the systolic blood pressure. Now let's take the systolic blood pressure. Now let's take the diastolic blood pressure. For taking the diastolic blood pressure, make sure the stethoscope, the buds of the stethoscope should be facing the opposite side of you. Place the bell of the stethoscope on the brachial artery and feel the pulse. Now inflate air inside the sphygmomanometer . Slowly deflate the air . While deflating the air, at a point of time, you will hear the first Kirchhoff sound, and that is the systolic blood pressure. And the sound goes on continuing, and at a point of time, at one point, it becomes dull. So that point is called the diastolic blood pressure. So the systolic and diastolic blood pressure of my patient is 118/78. Thank you.